I'm Moghan Prakash from OEM. I'm here today to interview Mr. Santara Mohan, who is an Honorary Secretary of CASP, which is an abbreviation of Community Aid Service Penang. Hi, sir. Good evening. Sir, can you tell me more about your organization?
Before I talk about my organization, let me go through the history of HIV and AIDS.
Sure.
It all began in 1981 in Los Angeles, 1981 Los Angeles, where it was found that gay men had certain deficiencies when they found out that they were all having pneumocystis carinii pneumonia, which is basic pneumonia, which is very unusual. It only occurs in people who are immunosuppressed. Immunosuppressed means that their immune system is lowered, and it is surprising. It was surprising, and then from there it spread on to New York. Also, they found out that among gay people they had this condition where the signs and symptoms indicated that their immune system was compromised. Okay, we had our first case in 1981 in Los Angeles, and we had our first case in 1986 in Malaysia. That was a period of 5 years after that. We had our first case here, and this was found. Found to have this person who came here who had this HIV was from California also. So he brought it on. He brought it from America too. And that was our first case. In 1989, being aware that we are having a few cases in Malaysia, we formed an organization called Community Aid Service Penang, which provided information and counseling through the phone. That was in 1989. In 2006, we found that there were patients who had AIDS, acquired immunodeficiency syndrome. That is, HIV means human immunodeficiency virus, but AIDS means immunodeficiency syndrome. And these people were stigmatized, and they didn't have a home to go to. So we thought that this organization should provide a shelter for them, and that was in 2006. Then in 2010, we approached the church to provide us with a building, and they provided us with a building, and we renovated the building, and we had about 19 beds. We had 19 beds for men living with AIDS, and for ladies too. So we had clients from all races, that is the Indians, the Chinese, and the Malays also. And these patients who came to our shelter were in a very bad condition, and most of them were bedridden, and they were not welcomed with the family. Society neglected them, and they were from sidewalks or from hospital beds where they were there for a long period of time. So this is the service, and we are the only service provider in the whole of northern province of Malaysia, and also we are the only service provider who have accepted patients with very bad disabilities, like they're blind, they are not able to walk, and they are on pampers, and they are bed sores, and who need palliative care, 24 hours care to support, to take care of them. So we have 9 workers, and these workers are all have been trained. They are not trained nurses, but they've been trained by medical assistants and doctors. Like me, I trained them to provide service, nursing care service to them, and they've been looked after 24 hours. So among the 9 people, we have an administrator who runs the shelter, and we have 24 hours care. That will be morning, afternoon, and night. We have a van driver too, because these patients have to be sent to the hospital for further treatment, and this is what we have been doing all this while. So we receive patients from Malaysia, even from here, patients from Sabah and Sarawak too, and from Johor and Malacca. And so far, it has been we have been doing quite well, but unfortunately at the moment, because of the MCU and all that, we find that the donations we had is drying up, and we need donations from donations been drying up from people. Our general population have not been coming forward to give us donations. Actually, our shelter, our community service Penang is affiliated under the shadow of Moghan Malaysian AIDS Council. The financing of this shelter is provided by Nutrition Kesihatan Malaysia, who provide about 60% of the funding. 40% of the funding we have to source it from donations. We have a shelter, and we have actually 3 programs. The shelter is one, provide shelter for clients who need care and all that. We have a peer adherence program, a peer adherence treatment program where HIV clients, HIV patients, they go to hospital, and they have a clinic for HIV patients in Penang, and also Sunang Rai, and also all the other clinics also. So my worker goes down there and sees that gives counseling, and see that these patients who are HIV positive or under treatment and all that, they come to the clinic constantly and do not miss the treatment. And that is another program. Another program, the third program will be we have clients who are HIV positive who go and target transgenders, bisexuals, gay, or men having sex with men, and try to get them tested and to see if they are positive. If they are positive, then we refer them to general hospital or the nearest hospital or nearest clinic where they will be examined and treatment will be carried out. And we have done quite well in these 3 aspects, and what we find out now is that HIV, the spread of HIV, the demography of HIV is entirely different from previously. Previously, about 60% of HIV patients were drug users, but now the scenario has changed. The drug users now, the drug users have been. We had a program, a harm reduction program, where syringes have been given to them, needles have been given to them, and we have this opiate substitution program where methadone has been given to them, and this methadone has been given by the hospitals and also selected GP general practitioners. So we find that patients having drug addicts, intravenous drug addict patients, the spread of HIV has come down from almost 60% to almost over 3%. But what we find out now is that HIV is spreading among men having sex with men, which is now about 53% of the population, the HIV population. And the other part of it is men having sex with men, is about 53%. The other one is men and female, bisexual, but mostly it's men and having sex with men. Heterosexual sex is also there, but about 30% altogether. Others are not there, men having sex with men and bisexual. These are the 3 programs we are running at the moment.
Okay.
We have anything more about that.
I think that's about all the information that we need for you. Thank you so much for your time, sir.
No, you all are very welcome. Probably I will need some volunteers from the university to come and help us out.
Sure, sir. We'll do more.
Yeah. Thank you for coming over.
Thank you.
And please spread this message to all your colleagues saying that HIV is not a dreadful disease. HIV is a manageable disease, and we have enough drugs to bring down the viral load. I didn't talk much about the disease itself, but what I did was I was talking about what CASP did. I didn't really talk to you about the disease itself. So our aim is in 2030, we want to have 90% of all these clients tested for HIV, 90% of them being treated, and 90% of them the viral load comes down to a stage where they do not spread HIV. We hope that this can be done by the year 2030. That is our aim.
I think that's about all you need to know about HIV and CASP. Thank you so much for your time, sir.
I see.
Okay.
It's okay. Thanks, fish curry. Ada baik ada? Pakai belakang
Alamat Amali.
Yalah, saya sakit lah. Saya pun sakit. Edward,